Have you ever noticed that erections seem weaker than they used to be? Curious. Maybe they take longer to appear. Maybe they disappear faster, or maybe something strange happens. You can have strong erections when watching pornography, but when you are with a real partner, things suddenly change. The erection is weaker, or it disappears, or it simply does not happen. And this raises an important question. Can pornography actually affect erections? Can watching too much porn change the way the brain responds to sexual stimulation? And why are more and more young men experiencing erectile problems today, even though they are healthy? Surprised. This is something doctors around the world are beginning to notice. Men in their 20s, men in their 30s, men with no cardiovascular disease, no diabetes, no hormonal disorders, but they still report weaker erections. So, what is happening? Is pornography really capable of affecting sexual performance, or is this just another myth circulating on the internet? In this video, we are going to analyze this topic in depth. We will talk about how erections actually work, how the brain controls sexual arousal, how dopamine and reward circuits influence sexual behavior, and how excessive pornography consumption may change the way the brain responds to real sexual stimulation. Because the truth is that sexuality is not only physical, it is neurological, psychological, hormonal, and behavioral. And understanding this interaction is the key to understanding why some men begin to experience erectile problems even when they are physically healthy. But before we go deeper into the topic, let me briefly introduce myself. My name is Dr. César Noval. I am a plastic surgeon and specialist in male sexual surgery, including penile enlargement procedures and gender surgery. I am also the director of Clinica Nev, where we treat patients in Spain, Mexico, and Miami. Our team specializes in advanced surgical techniques for penile lengthening and girth enhancement, and we have treated patients from many different countries. Our main YouTube channel, Clinica Nev, in Spanish already has more than 100,000 subscribers, where we publish educational videos about male sexual health, erections, penis anatomy, and surgical treatments. This English channel was created using artificial intelligence technology so that we can bring this same information to a global audience. Because unfortunately, male sexual health is still surrounded by myths, misinformation, and unrealistic expectations. And our goal is to provide clear medical information based on science and clinical experience. Now that we have introduced the topic, let's start with something very important. To understand how pornography may affect erections, we first need to understand how erections actually work. Most people think erections are simply about blood flow, and it is true that blood flow is extremely important. When a man becomes sexually aroused, the brain sends signals through the nervous system. These signals cause the release of nitric oxide in the penile arteries. Nitric oxide relaxes the smooth muscle in the blood vessels. Blood flows into the erectile chambers of the penis. The corpora cavernosa fill with blood, and the penis becomes rigid. But here is the key point that many people forget. This entire process starts in the brain. Sexual arousal is not just physical, it is neurological. The brain must interpret stimuli as sexually exciting. Only then does it activate the physiological mechanisms that produce an erection. And this is where pornography can play a role, because pornography strongly stimulates the dopamine system. Dopamine is a neurotransmitter associated with pleasure, motivation, and reward. Whenever we experience something pleasurable, dopamine levels increase. This is part of the brain's reward system, the system that encourages behaviors that are important for survival. Food, social interaction, sex, all activate dopamine, but pornography introduces something unique: unlimited novelty. When someone watches pornography online, they can instantly switch between different videos, different partners, different scenarios, different types of stimulation. This creates a constant stream of novelty, and novelty strongly increases dopamine release. The brain becomes highly stimulated, but over time, something interesting can happen. The brain begins to adapt. This is called desensitization. When dopamine receptors are repeatedly overstimulated, their sensitivity may decrease. This means the brain requires stronger stimulation to achieve the same level of excitement. In other words, the brain becomes accustomed to intense visual stimulation. and real life sexual encounters may not produce the same level of stimulation. This is one of the mechanisms proposed to explain what some researchers call porn-induced erectile dysfunction. In this situation, erections may still occur during pornography use, but they become weaker during real sexual interactions because the brain has been conditioned to respond primarily to a specific type of stimulation. Highly visual, highly novel, highly stimulating, and real life is different. Real sexual encounters involve emotional connection, physical sensations, communication, and unpredictability. For some men, the brain may struggle to adapt between these two environments. Another factor that may contribute to this phenomenon is performance anxiety. When men become aware that their erections are weaker during real encounters, they may begin to worry. And anxiety activates the sympathetic nervous system, the fight or flight system. This system prepares the body for danger. But erections require the opposite. They require relaxation, parasympathetic activation. So anxiety can interfere with erection quality. And the more a man worries about his performance, the more difficult it may become to maintain an erection. This creates a cycle. Concern leads to anxiety. Anxiety leads to weaker erections. Weaker erections increase concern, and the cycle continues. Another important factor is sexual conditioning. The brain learns through repetition. If sexual arousal repeatedly occurs in a specific environment, for example, alone in front of a screen, the brain may begin to associate sexual excitement primarily with that context. This does not mean that pornography inevitably causes erectile dysfunction. Many men consume pornography occasionally without experiencing any negative effects. The issue tends to appear when consumption becomes excessive or compulsive, when pornography replaces real sexual experiences, or when it becomes the primary source of sexual stimulation. In these situations, reducing pornography consumption may help restore normal arousal patterns. This process sometimes requires time because the brain must readapt to different types of stimulation. During this period, some men may notice temporary changes in libido or erection quality, but as the brain readjusts, normal sexual responses often return. This is why understanding sexual health from a neurological perspective is so important. Because erections are not just about the penis, they are about the brain, the nervous system, hormones, psychology, and behavior. When all these systems work together, sexual function is usually normal, but when one element changes significantly, the entire system can be affected. This is why education is so important, because many men believe erectile problems are permanent, but in many cases, they are reversible by improving lifestyle, reducing stress, improving sleep, maintaining cardiovascular health, and sometimes adjusting sexual habits.
If you found this information useful and you want to learn more about male sexual health, erections, penis anatomy, and medical treatments, make sure to subscribe to the channel. Our goal is to bring clear, scientific information about male sexual health to a global audience, because understanding your body is the first step toward improving it.